So pinhole surgery is a surgical technique that is used to treat gum recessions. So with receding gums in time causes a lot of sensitivity on the teeth. It even in return causes mobility on the teeth as well. So lots of patients that come to see me actually have issues with drinking cold water, their favorite ice creams, or even just room temperature foods. And before, we could not really do much about it. All we could do was actually treat it with giving them fillings or crowns that actually eventually makes the teeth look so long. And that actually does not prevent further recession from happening in the future. But with pinhole surgeries, we actually bring back the gum lines to the way it should be. So, and also we make it a lot thicker. We bulk out the tissue as well, so it further prevents the chances of the recession happening in the future. Pinhole surgery is a radical surgical technique that was developed by Dr. Chow roughly about 17 years ago. It's a very much easier technique compared to a conventional grafting surgery, where you actually have to get a donor tissue, a healthy donor tissue, and then actually graft it into the area of concern, which is quite painful and actually takes a little bit longer for you to heal as well. With pinhole surgery, we do not need a donor tissue site. We do not need any sort of cutting. We do not need suturing. It is a relatively safer and easier technique that we use on patients, so it actually even heals faster without causing so much pain on patients. Most of my patients actually come and ask me if I did something wrong, because there is no pain on the surgery site that we worked on. Patients that come to see me usually have no cavities at all because they're brushing so well, a little too well, as a matter of fact. They actually brush using a medium or hard bristled brush, and they are brushing their teeth and their gums away. So most of the time when they come to see me to get treatments with pinhole surgeries, patients absolutely have no cavities at all. They're brushing way too much into their gums, and they need to start using soft bristled brush. If we do not do treatments to treat those recession areas, most of the times the recession will still go on to a point where the patients will feel so much sensitivity even when they talk. And also it is going to recede so much to a point where the tooth is now in jeopardy of being lost. You are slowly going to notice mobility on the teeth, and eventually those teeth will lose grip, and it will have to be extracted in the future. Most of my patients that came to me back in the days, I actually could not help them as much as how I can nowadays. All I could do was give them fillings. All I could do was make them crowns, or even small grafting surgeries that is going to cause so much pain on my patients. And hence, I seek to find there must be better ways to treat these kind of gum recessions. And I was very lucky enough to be able to come in contact with Dr. Chow, and was able to learn the technique and be certified to be giving treatments using pinhole techniques, which have shown great results, great predictability on the results as well.